A new wave of states issuing stay-at-home orders tonight, finally recognizing the restrictive measures could be our best chance against this pandemic. Residents now in 39 states and Washington, D.C. under orders to stay inside, including Florida, where the governor has been under increasing pressure to act statewide as the virus took hold. The country tonight coming to grips with a grim prognosis as we approach what could be our darkest chapter in all of this. Our correspondents are in place again tonight, and Miguel Almaguer starts us off.
Losing more Americans in greater numbers every day to the coronavirus, tonight our national death toll spiking to a new benchmark as the White House implores everyone to stay at home for 30 days.
It's a matter of life and death.
But tonight, governors in roughly a dozen states are refusing to issue that mandate, despite growing pressure from doctors who say the order will save millions of lives.
It makes sense to make this move now.
After weeks of resistance, today Florida's governor joined the majority of the country, telling Sunshine State residents to stay home. Sam Brock is in Miami.
Florida has a population of 21.5 million people, about 1 in 5 of whom are 65 years or older. That's the group that's most at risk of losing their life to this virus.
Facing a grim new reality, the White House projects in just weeks, more than 2,200 Americans could die each day from the virus, with up to 240,000 lives lost if every precaution is taken.
Each of our behaviors translating into something that changes the course of this viral pandemic over the next 30 days.
The crisis crippling New York, but spreading quickly across the nation.
To the extent people watch their nightly news in Kansas and say, well, this is a New York problem. That's not what these numbers say. Tomorrow, it's a Kansas problem and a Texas problem and a New Mexico problem.
With the CDC estimating 25% or 1 in 4 coronavirus carriers shows no symptoms, there is growing worry they can blindly infect others. Off the coast of South Florida, government leaders are worried about a wave of new cases. 3 troubled cruise liners loaded with sick passengers are all hoping to dock in Fort Lauderdale. Meantime, in Guam, the USS Theodore Roosevelt, a wartime ship, is tonight at battle with the virus. Nearly 100 sailors testing positive, but thousands more are aboard.
Once the virus gets on a ship like that, it's going to spread.
As the number of new infections climbs, more of our nation is shutting down. In California, 6 million children not expected to return to school this year. In Arizona, the National Guard is delivering food, while in Oregon, ventilators are being delivered to medical centers. States that ordered residents to stay home early faring better than those who didn't.
The good news is that states like Washington, like California, countries like Italy, when they leaned into aggressive mitigation, they're being able to flatten their curve.
Bracing for the worst day still to come, at the Soldiers' Home in Massachusetts, 13 veterans who risked their lives for our country lost their fight to the illness.
This episode is a gut-wrenching loss.
In Missouri, 27-year-old Brittany Greco says she was hospitalized even though she's young and healthy.
It is terrifying. I don't think there's any age where this wouldn't be scary.
Tonight, our nation already exhausted by a fight that has just begun.
While social distancing appears to be working in cities like Los Angeles, in this county alone, there were more than 1,000 new cases in just 2 days. A big concern is the homeless population. Lester?
All right, Miguel, thanks very much. Now to the crisis here in New York City, the epicenter where more than 1,000 people have now died, where the worst may still be weeks away, and where the governor made an urgent plea today for people to do their part to stop the virus. Here's Gabe Gutierrez.
It is a city in shock as the line grew outside this food pantry for the homeless today. Across town, sick patients began arriving at this makeshift hospital in Central Park. In New York State, the number of COVID-19 deaths jumped 25% in just 24 hours. And Governor Andrew Cuomo now says the peak likely won't come until the end of April. Today, he shut down New York City's remaining playgrounds, frustrated with people who aren't social distancing.
How reckless and irresponsible and selfish for people not to do it on their own. Who else has to die for you to understand you have a responsibility in this?
On the front lines, exhaustion.
Behind those big goggles, most of us are fighting back our tears while fighting the disease.
Sion Faroux is an ER doctor in Manhattan. She served as a medic in Iraq and says this is worse.
I don't think I was emotionally prepared to witness this in the U.S., like for when going to a war zone.
The vast majority of those who've died have been older with underlying health conditions, but there have been losses of all ages. Desanne Romaine was just 36, a well-respected teacher and principal in Brooklyn. New Jersey firefighter Israel Tolentino was 33, the father of young children. Rabbi Romy Cohn of Staten Island resisted the Nazis and survived the Holocaust. Dr. Frank Gabrin worked at ERs in New York and New Jersey.
He went into medicine because he wanted to help people.
His family and friends believe he died because he didn't have enough protective gear.
When the paramedics arrived, he was already stopped breathing.
Gabrin was well known in the medical community, devoting much of his career to helping colleagues avoid burnout, even writing this book.
It's absolutely heartbreaking to have to see the amount of people reaching out and talking about the difference that he made in their lives. I'm sorry. And he's not here to know what he did do mattered.
And right in the middle of typically bustling Manhattan, many hospitals now have this, a refrigerated truck, a temporary morgue. Sobering reminders of the growing emergency. Lester.
All right, Gabe, thank you. On the front lines tonight, fear, heartbreak, and heroism among those treating and comforting the sick and dying while trying to protect themselves and their own families. Stephanie Gosk has their stories.
We are not okay. We are tired and we are scared. If I infect my husband or my 4-year-old daughter, who I haven't hugged or kissed in weeks now, it'll be my fault.
It is a ruthless irony. The health workers who can't get close to their own families.
Even if I don't have symptoms, I could have already had it or I might have it now.
They have had to become family for their patients. Hospitals aren't allowing visitors.
These patients have to die alone. And I'm sorry to be so blunt, but it is the truth. Families are having to say goodbye via FaceTime.
Justine Bender is a nurse in Maryland.
We have taken on another role. Family member and friend. We do our best every day to provide for each of our patients based on their needs. But right now, it honestly feels impossible.
I know you're at home, but we are the doctors, the nurses, the housekeeping, the clerks. We are the closest to your family right now, and we're going to take care of them.
Last week, an elderly man walked into North Shore University Hospital.
We were pretty sure he had COVID. He was having trouble breathing. I said to him, what can I do? Who can I call? He said, can you call my wife? And he was too short of breath to talk to her. And I said, what can we tell your wife? You know, and he said, I just want you to tell my wife that I love her and I hope she's okay. And my intern and I walked out of the room and cried outside of the room.
Less than a week later, he died. And then there was the man with dementia and respiratory problems who came to Dr. Matthew Foley's hospital.
The only thing that would calm this person down was stroking his head. Immediately calmed down. So it was the little easy things that made this patient feel better.
I think each one of us breaks down at a different time of day. And just having to be there and not knowing what to say to make it better, because right now it's not going to get better. It's going to get worse.
Christina Norstein is an intensive care nurse.
I worry about taking this home to my family.
What have you done to protect your family?
I left my home. I'm staying at a hotel.
Her daughter is battling lupus. Norstein could be living in a hotel room for weeks.
What would you say is the single hardest thing for you over the course of one of these shifts?
Just seeing the sadness.
Where do you see the sadness?
I see it on everybody's face. Everybody who's walking around, they're stunned.
I love my job. I love being a nurse. And now more than ever, we need to come together because we're quite literally fighting for people's lives and for our own lives.
They appreciate the public support. They need more help. And they hope someone is listening. Stephanie Gosk, NBC News, New York.
So tough. We ask so much of them. And as doctors and nurses fight this battle, there is even more urgent alarm tonight about what's really left in the national stockpile of life-saving equipment and supplies, and questions about why governors are apparently forced to compete with each other and the federal government to buy what they desperately need. Here's Jeff Bennett.
Tonight, with the demand for emergency supplies surging, the federal government's reserves are running thin. The Washington Post reporting the national stockpile of personal protective equipment is nearly empty, despite assurances from the White House.
The U.S. stockpile is nearly depleted of PPE. Is that the case? And if so, how are you planning to mitigate
because
that?
We're sending it directly to hospitals. We don't want it to come to the stockpile because then we have to take it after it arrives and bring it to various states and hospitals.
The scramble to purchase supplies to deal with the cascading coronavirus crisis has some state governors raising red flags.
It's just a madhouse out there.
They're calling for a more coordinated response from the Trump administration and an end to the current patchwork approach.
Either people are over-promising or we get outbid at the last moment, often by the feds, by the way.
So you have 50 states competing to buy the same item. It's like being on eBay with 50 other states bidding on a ventilator.
Just a little over a week ago, we made an $18 million purchase on PPE equipment and things for our first responders and for our hospital personnel out there. As of today, that same order will cost you now over $30 million.
It's not just governors calling for clarity, but suppliers too. The CEO of a New Jersey-based clothing company that's now making face masks says the entire system is decentralized and disorganized, making it hard to get gear to those who need it.
There's questions about who's making the decision, who's buying it, and there isn't really one entity that can then make a purchase, for example, for a state and distribute that across everybody that needs it.
And state officials are still sounding the alarm about test kit shortages. Maryland's Republican governor says that without enough tests, he's left flying blind, having to guess about where the outbreaks are in his state. Lester?
All right, Jeff Bennett at the White House. Thanks. Hey, NBC News fans, thanks for checking out our YouTube channel. Subscribe by clicking on that button down here, and click on any of the videos over here to watch the latest interviews, show highlights, and digital exclusives. Thanks for watching.